Hey, Josh here with Patient Mastery, and this month we are talking collections breakthrough in Patient Mastery. That's a dynamic matrix. I'm going to show you one of the strategies today for docs who are stuck below the 20,000 a month collections mark. However, this strategy doesn't just apply to you, it's just what oftentimes is one of the factors that keeps great chiropractors stuck. However, you might be at 30, 40, 50, 60 and still need to implement this, and it'll just make things flow easier. Be able to see more new patients, have better energy, be able to have more retention and conversion, and just grease the wheels for being the go-to doc. When it comes to chiro new patient scheduling, think about cluster scheduling in terms of your normal adjustments. When you're first starting out and you may be seeing 10 people a week or 12 people a week, the goal is put them all next to each other for many reasons. One, you're not sitting there in between patients wondering what to do. Two, patients when they come in and leave, hopefully are seeing someone else that's not a ghost town, and it just keeps your energy and allows you to have more space outside of those blocks for doing practice building growth. Same thing happens when it comes to new patient scheduling. What we notice is practices that put new patients, the CA puts new patients wherever they could find a 30-minute, 45-minute, 1 hour gap, whatever you need to process your new patient. And it might go anywhere. That causes chaos inside the practice for many reasons. One, you're not always gonna have those 30, 45-minute or an hour, especially in a busy practice, gaps randomly, organically for your CA, your office manager, whoever's taking the phone call to put in. So when it starts that they have to start putting people 4 or 5 days away, a week later, that person is most likely gonna make the appointment, but then think, you know what, I don't wanna have to wait 3, 4, 5 days, let me call someone else. And they go somewhere else, or they just don't make the appointment and they go somewhere else, especially if your online booking calendar doesn't have something within the next 72 hours. But more so for the chiro, for you, if every single day in practice, you don't know what's coming up next. You're adjusting from 9 to 10, and then sometimes you have a new patient at 10, other times you're adjusting from 9 to 11 or 9 to 11:30, and then you have a new patient, or sometimes you just start the morning with a new patient. It's frazzling because you need to have amazing tone and energy when you enter with a new patient, because it's your new patient's first experience with you, maybe first experience with chiropractic. Now, just because it's your 2,000th or 10,000th or 20,000th new patient, and it's so simple, you're going through the routines, you could do it in your sleep, that's not the way to approach a new patient, because they're gonna remember this forever, and it's gonna be the biggest determining factor on if they pay you out of pocket. So you wanna have your headspace and your energy set. Part of the thing that makes that happen is having set new patient schedules. So let's just say you're doing Monday, Tuesday, Wednesday, Thursday in the practice, Friday, Saturday, Sunday off from seeing patients. You have CEO time Friday morning, 3-day weekends, even without holidays. It's amazing. And let's say you have an adjustment shift in the morning and an adjustment shift in the afternoon. And let's just say this is like pretty constant here. You should always have lunch. You need some downtime in the middle of the day. Now, you can schedule where new patients go anywhere, or you can know, hey, am I a morning person? Do I love seeing patients first thing in the morning? Am I end of day? I love seeing a new patient at the end of the day before I go home? Or is that like, you know, my energy's low, I don't want to go through a new patient consult at the end of the day? Or bookending lunch or another time. Bottom line is, there are multiple slots. Let's say first thing in the morning before lunch, coming back from lunch, end of day. Depending on your adjustment, you could even do one, right in the middle. So let's just say you start the day, let's say from 9 to 12 is your morning shift. You could do 9 to 10:15 adjustments, 10:15 to 11 new patient, 11 to 12 adjustments. What I'm getting at is there are 6 options per day. Most likely, if you're a single practitioner practice, you do not need to see 6 new patients in a day, and you don't even want to. You pick which ones out of these 6 are right for your energy. For me, I didn't want to see a new patient first thing in the morning. That just wasn't what I preferred. I also didn't want to see a new patient end of the day because sometimes I would get backed up in terms of leaving and getting home. So I still have 4 options to choose from. If you chose the 4 best and applied them across your schedule, so every day had 4 new patient slots, that equals 16 new patient slots a week. That equals what is that? Let's say about 64 a month in a 4-week month. As a solo practitioner, you do not need 64 new patients a month. If you're getting half of that, that's awesome. Just because you're putting them in the calendar, it means they're waiting for new patients. And when you do that, when you create structure in your calendar, in your life, in your practice, guess what? Things work out, things flow better. 4 slots a day, maybe you choose 3. This is what's on your online scheduling. This is what you can fill people in. And ideally, there's always a spot within the next 24 to 36 hours, because if someone's in pain, you want to be able to get them in and be seen and be comforted, even if it's just verbally, even if you're not starting treatment and adjustment. You create the space rather than, oh, we have a new slot here, slot here, slot here, slot here, slot here, slot here, slot here. Totally random. And you have different new patient energy every day, every week it's different. It doesn't cause things to work better. So I highly, highly encourage you to implement dynamic new patient scheduling. It will make things go easier. What we see from docs who do this is just by putting the open spaces on their calendar, life fills in a vacuum. It actually creates new patients calling in and booking because the spots are waiting for them, and you don't have to finagle, oh, well, we only have 25 minutes and we usually want 40. Can we still do it? Let's just stuff them in there. And then it's chaos. Create a structure that works for you, your life, your energy, your team, the number of new patient slots you want to have available to still be the go-to doc, have the practice you want, see and help as many people as you can and want, and make the money that you deserve to make. After you start getting new patients on the schedule, the next step is creating and providing that exceptional new patient experience. So even patients who thought insurance was going to cover, whatever it may be, that you are the answer to their needs to get them to the life they want, and they are happy to pay out of pocket because they want you rather than $20 a visit to someone who isn't you. When you're ready to install the patient mastery proven process, just duplicate it into your practice, the words, the structures, the fees, and it's not cookie cutter, it's customized to you, your philosophy, your technique, and different patient cases. Reach out, patientmastery.com, and we will show you with one-to-one mentoring, showing you exactly how to do it for your practice, to double collections, double profits, 3-day weekends, and love being in practice. Look forward to you getting this too, Doc. Thanks for all you do.